Exploding breast implant. This is Mary Magdalene, not to be confused with Mary Magdalene. Mary Magdalene is a Canadian social media star. She has admitted to having a whole slew of plastic surgeries, and you can probably tell which one she's had. She's admitted to multiple nose surgeries, eyelid surgeries, fat injections to the face, lips, butt implants, liposuction, fat transfer, and maybe a few breast implants. She started having these surgeries when she was 21 years old. She's 30 years old now and says she spent about $100,000. She says that she has 5,000 cc breast implants, which means 5 liters of liquid in each implant. And this is what she looked like. So what happened? She claims she heard a pop and one of her breast implants just exploded, leaving her like this. This can certainly happen, and as a board-certified plastic surgeon, I'm not surprised that this happened. You may or may not know, but breast implants don't come as big as these implants. Breast implants usually come about 800 cc's. She claims to have 5,000 cc implants, which means that these were probably either custom-made implants, but more likely the biggest implant they have, 800 cc's, that's just filled and filled and filled and overinflated. So as if you just blew up a balloon and kept blowing it up, at some point it might pop. And that's because the implant was not designed to hold as much saline or salt water that her doctor put in. You're probably wondering what kind of damage this caused to her body having a breast implant explode inside of you. Well, it probably didn't do much damage at all. The implant, when it explodes or breaks or pops or whatever, allows the salt water to leak out. Because it's salt water, the body will ultimately reabsorb it and it'll go through her system, and I guess she'll just pee it out at some point. The real damage is what's happening to that breast now that the implant is completely popped or deflated. What you see is a big uni-boob, or just one big implant that's intact. But what's going on with the other breast? Well, most likely it's deflated skin that's just hanging and empty. Having very large implants over the course of many years will stretch out the skin and really cause some damage to the breast tissue. And that's why responsible board-certified plastic surgeons would never advocate going this large with implants, because it can cause a problem, maybe not right away, but certainly long-term. So what's Mary's course of action now? Well, she says that this is kind of a sign that she's over these extreme surgeries, and she says she plans on getting her other implant taken out. That certainly will help, but it won't solve the whole problem. She might likely have to do something else with her breast tissue in order to help correct that empty, sagging, loose skin that's probably going to be there when the other implant is taken out. That might involve a breast lift, sometimes even putting back in a smaller implant to fill out the space. But this is just another example of extreme plastic surgery and some things that can go wrong along the way. I'm Dr. Matthew Schulman, board-certified plastic surgeon here in New York City. If you like this video, make sure to like, comment, and share, and follow the other videos on my YouTube channel.